Dr. Tiana Seetzy at RejuvenationMD in Burlington and Bellingham, Washington, and today we are doing some fillers. And fillers are mostly made up of hyaluronic acid, or I should say most fillers are made up of hyaluronic acid, which is something that we have in our skin to begin with. And as we age, though, our hyaluronic acid production goes down. It's still there, but it just goes down. And we have an enzyme that likes to eat our hyaluronic acid. So although the production is coming down, the enzyme's still pretty active, and we lose our sponginess to our skin. So most fillers do just replace your own hyaluronic acid. Today we're going to use a different procedure, a different product with calcium hydroxyapatite, but there's lots of different types of fillers, and it depends on what kind of skin you have as to which one we choose. Also, calcium hydroxyapatite is in our body to begin with, so again, no allergic reactions, no worries with that. So I am going to show you a great easy technique on how we are going to do our fillers today. So our patient wants to have some more cheek and a little bit in the nasolabial folds and a little bit in the marionettes. So we're going to do it, and she likes to bruise, unfortunately. But fortunately, she's got me injecting her, and what I'm going to do is I'm going to use something called a cannula. So first, I'm going to just give you a little injection spot of lidocaine, 1, 2, 3. And sometimes this is a little spicier than the rest. And I'm going to go run this side and go 1, 2, 3, little la 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 right there. And this is a very strategic location to put the lidocaine, because from this location I can go up to her cheek, I can go into her nasolabial fold, and I can turn it down and get her marionette too. So you'll see in just a minute. It's going to rub it right there as to how this works. And you can see it starting to work. Especially on this side, you can see a little blanching because the lidocaine has epinephrine in it, which does tend to blanch the skin because it's constricting the blood vessels, and it lets me know where she's numb. So it's a little helpful hint for me, and the fact that it constricts those blood vessels is helpful for her, because then when I put the cannula in there, there'll be less chance for her to bruise, which is what we like, because we don't want anybody to know what we're doing unless we want to tell them ourselves. So I'm going to just see how numb you are. Are you numb here? Mm-hmm. Awesome. 1, 2, 3. Good job. And let's see. Can you feel that there?
A tiny
bit. How about over here?
Yes.
Okay, so we'll wait on that side. We'll come back to that side. Sometimes the lidocaine takes a little bit longer. And I know I am a huge fan. I know I'm a huge fan. Everybody maybe that's watching this knows I'm a huge fan of cannulas, which this is a blunt tip. So there's no needle at the end of that. And you go, that's craziness. It looks like a needle, but it's not. There's no point. I mean, I can take I'll show you a point. This is a point with a needle at the end of it. Mm-hmm. And this is a blunt tip. So it's just like we just went like that. The bonus of using this is multifold. One is because it's a blunt tip, if we run by or get by any blood vessels, it kind of pushes them aside. So less chance for bruising. Also, again, it's pushing them aside for less, and so therefore it's less chance for us to get any occlusions or any of the filler into a blood vessel, which we don't want to happen. And then it's much more comfortable. I don't have to poke her 30 times to get the result that I want. Just go in with the cannula. Lastly, as I glide through her skin with the blunt tip, I'm irritating a bunch of those cells. You'll see when we go in, you can kind of see sometimes it takes a little bit of pressure to get through there, and I'm irritating a bunch of cells. Well, those cells kick into fight or flight mode. They can't go anywhere because they're stuck in your skin. So they fight back by making more collagen. So simply by using the cannula, you're going to make more collagen. So anyhow, that's a long-winded reasoning for why I like cannula. I told you I explained it, so here I did. Okay, now we're going to go in through my little channel. Now I needed to make that channel because remember there's a blunt tip, so I wouldn't be able to get into her skin without a little port. All right, so we're going to go right up here. Feel me just gliding across, and you can kind of even see my cannula is way up there. I think we're just going to go up a little higher. And here we go, a little filler right up in there, and you can see it filling. And I always tell people that when we do cheeks makes the biggest difference. It's like you're building a house. You would not start by putting bricks in the house. You'd start with the scaffolding, and the cheeks are the scaffolding. In fact, I remember one man, he came in and he's like, I just want my lips done. And I'm like, well, first of all, you have no cheeks, so let me start there. And at the end of it, I mean, he had cheeks, he had lips, he had nasolabial folds again. He was over 70. He looked fantastic. So, and he's like, I didn't even know that was possible. So I think now people are getting the gist of upper face filler, because it is really the pyramid of youth. I'm sorry, it's the triangle of youth. It's the pyramid of aging, but it's a triangle of youth. So we're simply restoring the triangle of youth by doing some filler. You can also put filler up in the temples, which also is very youthful. That looks phenomenal as well. Generally, when you do that, it typically takes about a syringe per side. And you can use multiple different products. It just depends on your temples and how deep they are as to how many syringes they'll use. The nice thing about fillers is you can also treat your hands. We could put filler into the tops of the hands because that's a place for people to look their age. I always tell my patients that are doing their hands, make sure you start driving with your hands underneath the steering wheel, because the sun creeps in to your windows of your car, just like we were talking earlier about how the left side of your face ages more because of the driver's side window. So now you can see already, look at that. Isn't that so cute? I love it. Anyway, I mean, it's immediate. I've only done half a syringe here, but we're going to go and do the other rest of it down here, and then maybe we'll come back and add some there. But look at how easy this is. And I'm just going to turn my cannula and go this way. You okay?
Mm-hmm.
And we don't see any bruising happening, which is all good. Is it pretty comfortable?
Yeah.
Good. I know it kind of feels weird under there, doesn't it?
Just when it got started.
Yeah. Okay, good. There is lidocaine in this, so...
Yes, it's very helpful.
Yeah, which is nice. Okay, and now we're going to turn this downward. And we're going to go get these marionettes, which is such a rude name for this area down here, but I'm not the one that made it up. This area down here loves to bruise. So when I first got started and I was using the needle a lot down here, it always bruised people, and I thought, oh my God, I must be doing something wrong. But then, of course, I talked to people in the industry, and they're like, no, it just always bruises there. So how can we decrease bruising? Well, we use a cannula. So again, you could see there's all sorts of different sizes for the cannulas. So you can inject all sorts of places. I've been doing filler on the top of the breasts combined with the PRP breast lift. You could put filler in the booty to give a little booty lift. So there's all sorts of places. We can obviously do nasolabial folds. A lot of people are doing their chins now too, which is nice. But you can see, again, I haven't used that much over here, but you can see the difference here and here versus over here already. So I'm just going to keep on working on that with this rest of this syringe here. And we're going to go. And so if I go, oh, I think I need to go back. I want to go back into her cheek. Do I have to poke her again? No, because I have my little channel, which is very, very helpful. Let me see again. And you can see it's starting to swell a little bit, but that's okay. And then cheeks are very edgy. I always tell people they're edgy to start. Don't worry about it. It's all going to smooth down. But sometimes people can really be swollen and be edgy for a day or so. But that'll go away, and it just becomes very, very smooth. So we're going to go down here again. And look, she's not even flinching, right? And I always tell people too that filler is considered a medical device by the government. So if you feel it for a day or two, that's okay. You're supposed to. It's a medical device. I'm putting a medical device in your face. And but then you get used to it, and then you just see how cute you are and how much more youthful you look. The nice thing about fillers is that they work right away. And actually, remember the very first time I did filler on patients, I was setting up the office, and so we were doing tenant improvements. and we didn't have an office, but I wanted to order stuff. So I was ordering filler, and the rep called me. She goes, well, do you want to get some training before you open your office? Extra training? I was like, oh yeah, that'd be great. So I said, but I only have, A, I don't have any patients, and B, I don't have an office. And she's like, well, that's okay. So she came to my house and she recommended that I get my friends' moms. So I did that. So I had, I told 4 moms to come over, and they came over. I said, you come at 1, you come at 2, you come at 3, you come at 4. Well, everybody showed up at the same time because they were excited. They were getting some free filler and Botox. And I was like, what am I going to do with them? These people, A, I don't really know them, and B, they're just going to sit here and wait. And the rep was like, just wait and see what happens. This is going to be great. So they all sat around, got them some coffee, and I started doing filler on people. And it was such a great, exciting thing because they were looking at the person I was treating, and they're like, oh, are you going to make me look like that? And I'm like, absolutely, I'm going to try. And it was just this great little camaraderie. It was really cute. They didn't know each other, and it was just really cute. And so, Botox parties are one thing, but filler parties are a whole nother thing because you see it immediately. And it's especially, I was treating this lady the other day. She looked so good. And I was like, so now you're going to go out shopping for men? She goes, I'm done with men. I said, okay, then you find the girlfriend that you don't like. And then you go out to lunch with her and show her how cute your face looks. And people do think about the price, of filler. These aren't cheap, but again, if you're going to wear, I didn't say this before, if you're going to wear a shirt, and you're going to buy a $100 shirt, and then you're going to wear it maybe once a week or maybe every other week, spend that money on your face because you see that face every day and everybody sees it. So it's it's just a matter of what you want to invest in. So see how much of a difference that is between one side and the other side. And she might need more later, but we're gonna go to the other side and do that side next. But what a difference in just one syringe over here. So that's really pretty. So should we do the other side? Oh, you want to see? Oh, you want to see it too?
Yes.
Okay. There we go. Mm-hmm. See how that's lifted?
Yes.
And then we'll, like I said, this is going to swell a little bit more, but that's okay. And even if this swells a little bit down here, because there's some filler down here, don't worry. I didn't give you jowls. It's just the swelling, and then that will go away over a day or so.
Yeah, look at how much is...
Yeah, right? Mm-hmm. And you can also put some of this filler in your jawline too. So we can make a sharper jawline. Oh, yeah. By putting some right along that mandible angle right there, mandibular angle, and it will pull back. A lot of people are doing chins now. So when people have flatter chins, they're putting a little dot in the chin to help just bring it out. Not like a witch's chin, but just like a, a little bit of a bonus. A lot of times people have some volume loss. You don't really have it quite as bad as people typically have, like a volume loss right in this area. That when you treat that really just helps lift everything up. So there's a couple different areas that you could do filler for. So we're going to go to the other side now. I'll grab that. Thank you.
Thank you.
So far so good, huh?
Yeah.
Okay, good. And easy, right? You don't look like you're going to bruise at all. So I know. Because again, we only want people that we want to know. So let's go over here. And we will treat this side. You're probably numb by now. I'll just check. With our handy dandy channel maker. Can you feel that there? Nope. Awesome. So sometimes the lidocaine just needs a extra couple minutes. Sorry. There we go. Okay, I'm out. And let's go with our radius. And if you are somebody that does have nasolabial folds, this is nasolabial folds, I, again, always tell you start with the scaffolding before you put in the bricks. Because when you do that, it lifts up there, and then you don't need as much filler down there. So we definitely like to start from the top down. So we're going to go find our channel. I said we're going to find our channel. Sometimes our channel likes to trick us as to where it is. All right, here we go. And see, right up in there. Are you okay? Mm-hmm. Awesome. So I want to go just way high up on your cheeks because you got nice cheeks here. Oops, sorry, I need to pop you in the nose. We just need to get the cheeks up high.
Sorry.
It's okay. You doing okay?
Mm-hmm.
And let's see here. And then again, the second side is always hardest, right? Because you gotta make sure you get it nice and equal. You can just see you're doing great. It's amazing how much of this I don't even feel. I don't feel any of it. Oh, I've done my cheeks a bunch. I love getting my cheeks done. And usually I do mine about every 6 months. I just do it one syringe because just like the way it looks when it's nice and fresh.
Mm-hmm.
Cheek filler can last you up to 2 years. So that's a bonus. I always like to have the longer lasting cheek filler because who wants to get poked? But although you're doing great and you're not really, I think it's the cannula. Oh, no, it's the operator. That's why you're doing so good. Okay. So we're going to leave that spot for a sec. And we can mold this for up to 2 weeks.
Mm.
So that's why I always have my patients come in and come back in about 2 weeks and let's see, well, about 10 days, because then we can still mold. And I'm going to have you bring your head down for me a little bit. I like to look from the top, so we just need a little bit more there. And then we'll go do your nasolabial fold and your marionette on this side, which is definitely less than that left side. That left side is certainly more aged than the right because of that darn driver's side window. It also matters what side you sleep on too. So I always tell people that like to sleep on their left side, flip over, sleep on the right side. Easier said than done, right? I love to sleep on my left side. It's the only way I can sleep. So I freak out every day when I wake up on my left side. Oh,
My face.
my face. And then I go, okay, partners of mine, I need some more filler. And they go, okay. It's nice to work here. And have partners that you trust to put filler in. So now I'm going to just turn it and I'm going to go up into the nasolabial fold. And there's a artery that runs right here along the nasolabial folds called the facial artery, and it likes to be very squiggly. And you definitely don't want to get filler in there because you can get necrosis of the skin, which we definitely do not want. So doing it with the cannula lets me sleep at night because I know I didn't get in there. And we're going to go downward now. You okay? Gonna tag a little nerve there. Okay. Well, let's get it numbing. A little love right there. And how much filler you need. It really just depends on your skin and how quickly it pops up, how healthy your skin is. So again, I always like combining these with laser treatments and things to help improve the overall health of the skin. That's more of a longer term treatment than filler is, but they're both great together. Lasers, lights, all of that. Okay, you're doing great. Almost done here. We're gonna take a look here. You getting hot?
No.
Oh, okay, good. So yeah, it looks great. I mean, you're so cute. Look at how cute you are. You're so cute. I'm going to put a little bit more over here, and then I think you'll be really done. Well, good, because I just have a little bit more, so perfect. And we're also really conservative with how much filler we put in. People worry about putting filler because they go, oh, I've seen all these housewives and things, and they look terrible. And I go, yeah, because you're not going to know the people that have filler that look great because they're just going to walk by and you're going to go, gosh, she looks good. And, a lot of us have filler and you would never know it. And that's somebody that's had good filler done. So it really does matter who you go to, how much training they've done, if they do ongoing training, which me and all my docs here do. Ongoing training. In fact, we have a training on Saturday at 6 a.m. Yeah, I know I said it, 6 a.m. But, we do that because we want to make sure that we stay ahead of the game in terms of what we can offer and what the options are out there. So We just actually did a training the other day, Thursday too. So lots of training to stay nice and up on everything. So now what I'm going to do is I'm just going to mold it. So I'm going to have you open your mouth for me. And remember I said it's going to feels like the government considers filler to be a medical device. So yeah, it is. It's something that's in your skin. It's moldable, meaning you can move it around, so it's not, if you get a little lump somewhere, we can just squeeze it and we move it to places that we want it to be. And let me do the other side, turn a little bit more to me. And we did all of that just with that one poke, which is great. And so I would be able to go, well, if I was doing her lips, I would have put that poke a little lower so then I could just go over to her lips. But we weren't doing that, so I put it a little bit higher. But I could have lowered it and gone right here and here, and then I could have gotten her lips as well. If she decides to do her lips, then I would just do a little lidocaine, and then use a filler just like that with the cannula, but going into the lips. So really pretty. That turned out really nice. And you can see it took us, I don't know, maybe 20 minutes or so to do it. So thanks for being my model. You were great.